Hello, I'm so excited that you can join us for our event today. My name is Dr. Kathleen Behr, Behr Laser and Skincare Center, and we're so excited to go over the RHA fillers and how they're different, also how we've been loving the Redensity, and also to introduce the newest neurotoxin, Daxxify. And this lasts on average 6 months and has no human or animal protein, so it's completely almost vegan. And so we're going to go over all of these today. So make sure you stay to the end, enter your questions, and there are also some great raffle prizes. Either you can win a free treatment to the frown or the glabella area of Daxxify, or 1 syringe of RHA filler. Also, we'll have some specials that you can get only by attending this seminar, and that is going to be your 2nd syringe of RHA filler will be off $200. Or if you do your frown area with Daxxify, you will get your forehead area treated for free. So I'm so excited to explain why we bring these into our practice and what's new. So I can't wait to get started. So the RHA fillers are fillers that are minimally modified, and they also are great in areas of high motion. So that's why we brought them into the practice, and we've been loving them. Most recently, we added Redensity, which is for the fine lines around the lip, but we're very excited for that. We have RHA2 for the little deeper lines, RHA4 for the cheeks and chin, and RHA3 for the lips, the nasolabial folds, and other things in between. Also really excited that we're one of the exclusive offices to offer Daxxify. And Daxxify is the new neurotoxin that is peptide powered. This is the only one that has a peptide. It's not just the same. It's the same core neurotoxin, but this peptide protects that neurotoxin to allow it to get into the cells and work more effectively to block your muscles. So with that, it also is, like I said, has no animal proteins or human proteins. So we're very excited to offer that and explain how it works and how we think our patients are going to really love this. So they can come in just twice a year to get their filler and neurotoxin. Yes, so the RHA fillers are great because they're very minimally modified. So they're very minimally modified, and they're closer to our normal hyaluronic acid, which we all have in our skin. And also, you know, with this neurotoxin that we have now, again, it has no, the peptide powered is completely new. It helps, it gets into that neuron cell, and more active neurotoxin gets in and helps to block those muscles more effectively, to give you a very natural, complete blockage of depression or active muscles with a very natural appearance that lasts, you know, on average 6 months, up to 9 months. Now, if people's Botox only lasts 2 months, this may only last 2 months longer than that, but it's still going to be a lot less needles for those people who don't like needles, so we're very excited. So Daxxify is FDA approved to treat the frown areas, but we are also using it in any other areas that we use other neurotoxins, just for the longer duration. So we're very excited to offer that. Also, with the fillers, you know, the Redensity we love for the very fine lip lines, smile lines, anything that's a very superficial crease, sometimes in the frown areas. The RH2 gives a little bit more oomph, you know, for the mesolabial folds or those slightly deeper lines. The RH3 is great in the lips, also in the nasolabial folds and the marionettes. And the RH4 gives a little bit more structure when we really want to project that chin or add a little bit more volume to the cheek areas. So I think, almost anybody is a great candidate that's had neurotoxins before is a great candidate for the Daxxify. I think it's really, going to help people not come into the office. It is a little bit more expensive per treatment, but using only 2 treatments per year to get complete relaxation of your muscles versus the 3 to 4 needed with the other toxin. In the end, you're spending about the same money at the end of the year, and you're actually having less treatments and have to make less trips to the office for those things. So we'll probably combine most visits every 6 months for neurotoxin or Daxxify and fillers. For the RHA fillers, anybody else who's getting hyaluronic acid fillers, the RHA fillers are great for them. And we evaluate each patient on an individual basis to make sure exactly what's right for you. So the RHA filler, you really usually see results right away when we inject it, although you do get a little bit of swelling, and the main risk from that is bruising. So it continues to improve and become, even more natural over the first week or so, but then you're usually looking at a duration up to about 18 months. We do continually age during this time, and we say if you do treatments on a regular basis, it's kind of like filling your gas tank. If your gas tank isn't completely empty, you need less to fill it up. So that's why you give a more natural results, and people don't realize you're having anything done if we kind of do a little bit every 6 months. For the Daxxify, that's why we're so excited to introduce this, because the average or the median is 6 months. Some people get more, up to 9 months, and some people unfortunately get a little less. Those are the people that usually have other neurotoxins that may only last 2 months on this. Then this may be that this will last about another 8 weeks for them. So we're really excited to have both these products in our office. So with Daxxify, you can see some effect go into effect in the first day or 2, and then probably complete effect after a week. Daxxify is FDA approved, and I'm excited to say that the United States is the first place to have Daxxify FDA approved or approved anywhere. So often a lot of our other products come from Asia or Europe, but Daxxify is made here in the good old US of A. So with Daxxify, it's similar, is bruising the most common side effect. And often, we want to follow patients up, so we'll be checking that with them. But very similar side effect profile to other neurotoxins, and really depends on the placement of injections and the evaluation of the patient. But, sometimes people will need a little touch up. There's a very low incidence of dropping of the eyebrow, no higher than with any other neurotoxin. Nicole, how are you doing?
Doing well.
Good. So today we're going to treat you with Daxxify. We're very excited to treat you with this because this is the first protein-powered, neurotoxin. So it lasts up to 6 months on average, and up to 9 months actually, but 6 months on average. And it has no human albumin and no animal protein, so it's completely vegan. And so we're so excited to have you experience this.
Yay, can't wait.
It's a very similar injection pattern to the other neurotoxins that you've had.
Okay.
So first I'm going to evaluate you, and then I'm going to mark you, and then we're going to do the injection.
Let's do it.
Okay, perfect. So go ahead and rest your head back. What I'm going to have you do is go ahead and I'm going to wipe the area, so I have the area clean, because we always want to make sure everybody's skin is nice and clean when we're treating. So I can see right here where you have the maximum pull, and now relax and go ahead and frown again and relax. And we really want to get just the depressor muscles, so we're really going to do specific injections for each person, and go ahead and frown. And she's really pulling up on this, and then relax. And we want to make these low so we don't get any of the forehead, and go ahead and frown for me and relax. And then these are going to get all the muscles that pull down on the eyebrows and will help give a nice arch without making anything asymmetrical when she actually moves. So Nicole, today we're going to do a little augmentation to your chin. So we want this to be 1/3 and this to be 2/3. And when I look at your projection, your chin is a little bit recessed. So that's going to help underneath your chin and along your jawline. So we're going to do that, and then we're going to do a little filler in your lips. Are you ready?
I'm so excited.
Okay, perfect. Thank you so much for attending. Hope you realize how excited we are to have these products in our office. Please make sure you check your text and text yes so that you can be entered to get a free consultation. And during that consultation, you will be available to get some specials that were only offered to people watching this webinar. And that will be your second syringe of RHA filler at $200 off, second and third, or how many you may need. And also for the Daxxify, if you treat your frown area, your forehead will be treated for free. Also, that the winners, one patient will win, or person will win a free frown treatment with the Daxxify, and one person will win a free syringe of the RHA fillers, and you will be notified by email. So make sure that you check your text and enter to get a free consultation. Also, stay tuned for the next 15 minutes for a live question and answer period. Thank you very much.
I think we're officially on. Hi, everyone. Thank you so much for joining us on this December Thursday evening.
We're so happy, and we want to wish everybody a happy holidays, and we're all geared up, because we're big 49er fans. Anyways, but thank you all for watching, and we're going to answer some people's questions, and we always are available for more questions, in any time.
Yep. All right. So we're going to jump into the questions that people have submitted already, but please continue to submit questions in the question box. So let's see. We have a really great one to start off. Do I have to wait for my Botox to wear off to get Daxxify?
No, you don't. But, I think, you really want to get the maximal effect. So if you have some movement, we can do it. Even if you don't have movement, then you can start your time from there. Like I said, it's really neat how this is coated with this positive protein that helps it attach and make that neurotoxin last, and then helps it get into the cell better. And so we have both noticed, and
we got it.
We're both
last Monday.
Frowning at you right now. So, of course, we always like to try everything first to make sure it's good for our patients. Because if we wouldn't do it ourselves, we wouldn't do it for you.
Absolutely. All right. This is a great question, and I love it. How can I get Daxxify and RHA fillers in the same day?
Definitely. So we often do neurotoxins and fillers at the same day, and then they work very well together, and they help, if some people have a really deep line in their frown area, even at resting, then the Daxxify will help release that, but maybe fillers are going to be needed, but we can do fillers in multiple areas.
I think this is going to be really great for those people that it's hard to get in 3 to 4 times a year. I mean, so many of us have busy schedules, especially around the holidays. So this is great because you only have to come in twice per year to really maintain that excellent skin quality, and you're getting, your fillers and your toxin, checked in all at the same time. So that's awesome. And then we have, how quickly does Daxxify go into effect?
So with Daxxify, so it's good because we have done it ourselves, and I did it on my husband Bob, who's also our model in the office very often. And it really takes, again, I noticed some effect in the first couple of days, but it really does take probably, then I noticed every day a little bit more. I think it took effect a little bit quicker in Nicole.
Yeah.
It took effect very quickly in this area, but I pull a lot from my lateral eyebrows, so it took maybe 4 or 5 days to get to that. But I think it did very well with that.
Yeah,
And
I
very,
mean,
you could kind of feel it. And now we've done some other, we did Dr. Yato in the office yesterday, and today she's like, I feel something working, something different.
Yeah, I mean, the before and afters that you just saw in the video were mine. So by the third day of post-treatment, I was already like pretty much fully frozen, which is awesome. Okay. Are you doing to offer a membership for it?
Yes, so it is, we have the membership, and people who are in our toxin, so it's our toxin membership, will pay a certain amount and a discounted rate. Usually any of the toxins are $14 a unit. If you're in the membership, then it's $12 a unit. But then you pay a certain amount a month is $99 a month. But then you'll save up more because it will probably be that you come in every 5 or 6 months rather than every 3 months. So then you will have more money saved to use for the Daxxify.
Yeah, awesome. So it fits right in kind of with our normal toxin memberships. Okay, next question here. What can I do to help reduce the risk of bruising or swelling for both Daxxify and filler?
That's a great question. So one thing is to avoid any aspirin, any Motrin, a lot of different vitamins, vitamin E, any different herbal things can cause increased bruising. So those are things that you can avoid. Often, we have, different things in the office that you can apply afterward to help decrease bruising. But, and we just want to go slowly when we do the injections.
Absolutely. We have a couple products in the office too that can help post-treatment. And then I just have to read a couple of comments of people saying that my before and afters were looking great. So thank you. I also am in love with my results. So thank you for that. And then of course we have a question on the price per unit of this product.
So with it, it's the same price per unit as the other neurotoxins, but you're using twice a year rather than 4 times a year, but you use double the units, even though it's not the same because you have a different peptide around it. So over the year-long period, the price will be similar if you come in 4 times a year, but each treatment ends up costing about twice as much.
Yep.
The other thing is if you don't have to come in those 2 extra times, or you can come in for laser or other products, or if you don't have to come in those other 2 times, then it's saving you on time just coming into the office.
Absolutely. And some people even we've seen with the studies lasting up to 9 months, which is just amazing. So, okay, great question here. How does Daxxify differ from Xeomin? Does it have less additives?
So like I said, the Daxxify has no human protein or animal protein. Xeomin also has no accessory protein, but it has no human albumin, which is coated with most of the other toxins. So I think, all the toxins are good, but all the toxins are slightly different. And so we help identify which one is best for each individual. We love Botox and Xeomin. And, I think Daxxify is a great new alternative for those people who are busy and who are needle phobic. So
absolutely,
we really want to discuss what's the best for each individual.
Yeah. And I think that the important thing to mention here too is that this, the best product isn't always just determined based on the person, but their lifestyle. And this, really applies to a lot of those busy lifestyles. So lifestyle is a big piece that we take into account when identifying kind of the best product for each patient. Okay, here's a great question. I need Daxxify before I see my family for Christmas. LOL. How far before an event do I need to have it done?
Well, you can have it, usually to have full effect, like we say, it's 5. Nicole had 4 days. Usually it's 5 to 7 days. You'll start noticing some effect, though, fairly quickly. The biggest risk for this is bruising, but still very low risk. So, pretty quickly.
Awesome. And then we kind of already touched on this, but just to make sure, to clarify, do we need the same number or same amount of units as Botox?
No, it's actually it's different in it that you use usually for the frown area. A lot of times we'll use 20 units of Botox and 40 units of Daxxify. But then they're slightly different. Like I said, all units are different, hard to compare because when you use Dysport, you use almost 2.5 units per Botox. So each one is individual. So
because the amount of the neurotoxin isn't the only thing in that syringe, right? We have that either like the albumin or things like that. So the amount of actual neurotoxin is
this
equivalent.
Is a great question.
Yeah.
Eyes feel heavy.
I love this one. Does this new product make the eyes feel heavy like Botox?
So interesting. You can never get too old, and I'm almost 60, to stop learning. And just at the last meeting I was at, and in some of the new publications, we are doing injections slightly different. So when we inject the frown area, we want to actually inject lower. So we're now injecting a little bit lower because we want only the frown muscles that are pulling down to be affected and not the frontalis, which helps us lift. So with us, because we injected lower, we can still lift, and it actually is less likely to give that heaviness of the brows because we're doing a different injection technique. And this is just different, recently been published in a couple different journals. So probably we're injecting all neurotoxins in this new way. But like I said, some people's frown muscle goes across, some people goes up. So it's really important to go to a provider who's evaluating you in action and evaluating each person individual to get the best treatment.
Yeah, that's what I was just going to say. Like, as you saw during my my treatment during the event, she had me frown and relax a number of times, even throughout the marking, to make sure that she's looking at my specific muscle, how my muscles move, and make sure we're placing the toxin in exactly the right spot to avoid that heaviness in the brow. Okay, here we have a good one too. I have my next Botox appointment on January 4th. Can I get Daxxify instead then?
Yes, definitely. And then if you answer yes at the end, you can get your forehead free if you do your frown. So we have, like I said, we always start with the staff and make sure it's safe for our patients. This has been studied in, thousands of patients and has been up for approval for many years. So we feel very comfortable and confident in using it on us and our patients.
Absolutely. Okay, is it too late to start with fillers or Daxxify at my age of 73?
Everybody just wants to feel better. It's, I think my oldest patient is 100.
I think she turned 101 a couple months ago.
And she's just a lovely lady, and it just makes her feel better about herself. It's just going to make you feel better. It's not going to make you look 40, but we want to look just appropriate for our age and natural, and that's what we like to, produce in our office.
Yeah, absolutely. Never too late to do something for yourself. Wow, my Botox has lasted for over a year. Could I see the same results with this?
Yeah, that's really amazing if that happens. If it lasts for over a year, maybe for that person, I might just stick with Botox.
Right, seems to be working well for you. Is the cost about double versus Botox?
It is, but then you're using it about half as much throughout the year, and then you save on not having 2 extra visits to the office. And we'll see in the long run, but I see that it may give, and from the people who have been using it for quite a while in the studies, a more complete relaxation of the muscle, because I think a lot of people don't come in as often as they should for Botox, because really they should come in 4 times
every 3 months.
Every 3 months. And so they have movement, and then they're creating wrinkles in between. So this longer lasting will just help, with the skin quality.
Yeah, so it is about double the cost, but half the appointment. So really it's kind of evens out in the end. Okay, would love to have it. Can I use gift cards?
Yes, definitely.
Absolutely. We covered the price question. How much is RHA? We want to cover that as well too.
So the RHA is $750 a syringe, but then the second syringe would be $200 off if you look at this. So
absolutely. And does getting additional facial treatments shorten how long this might last?
Everybody has a slightly different metabolism. So for the toxin, once it's into the cell, I don't think getting other facial treatments is going to affect that to any certain degree.
Absolutely. Is convenience the only reason a person should change from Botox to Daxxify?
I think this is a toxin that really kind of gets absorbed into the neuron. It might get, more blockage of the neuron. So that's what we're seeing in some of the studies, and that's why we've tried it on ourselves. So I would say it's really a little bit longer lasting and giving you a little bit more complete relaxation of the muscle. But we're always still learning.
Yeah. And kind of like you mentioned before, it's hard for a lot of people to get in consistently for Botox those 3 to 4 times a year. So like convenience, yes, of only having to come in less, but also like ultimately better skin quality sustained for a longer period of time because your toxin is lasting that long and you're not creating those wrinkles in between. Can Daxxify be used around the eyes for those squint and smile lines, and then redensity under the eyes in the tear trough?
Yes, definitely. I mean, those work very well together. So often we squint with this muscle, the orbicularis that goes around the eyes. And then if we have a hollowness, we always want to be very conservative under the tear troughs, or we may need to augment the cheeks. But that's where we'll get your personalized evaluation.
Yeah, absolutely. I'm curious to ask her how she likes the lip treatment. I need lip lines, but would like lips done a little too. If you're referring to me as I absolutely love my lip treatment. They're so natural, and I just feel like they suit my face perfectly. But for those lip lines, redensity, if you don't want to add too much volume for those lip lines that are kind of above the actual lip itself, between the nose and the actual lip, the upper lip, redensity is great for that because you can, put it there without adding volume, which is
and you can
awesome.
Do both, but often when we're treating that peri, or we really do want to do fillers in the lip, often to help the lips, especially as we age, we may need to do the upper lip, which is the skin part of the lip, or the nasolabial folds, which we lose volume, and we lose volume in our dental, so that helps also to lift the lip. But in somebody young, we can just put it into the lips themselves. So every patient is unique.
Absolutely. So another question about gift cards. So yes, you can use your Week of Beauty gift cards on this product. And then to review the specials again. So for the RHA filler products, your first syringe will be full price, and each additional syringe will be $200 off. Again, those are priced, full price is $750. So that first one will be full price, $200 off any additional syringes you may have. And then for the Daxxify special, we have treatment to the frown. If you buy that, you will get treatment to the forehead for free.
Let's look at the last one there.
This one here?
Yeah.
My Botox only lasts about 2 months. So can I expect or hope for at least 4 months with Daxxify?
That's exactly right. I mean, all of these things, when they do them, are an average. And like I said, the average for Daxxify is 6 months. Some people get up to 9 months, and some people who only get 2 months with other toxins probably will get about 8 weeks longer, which is about 4 months.
Absolutely. Great question. Also want to remind everyone too that you guys will be all receiving text messages after this, the conclusion of this event. So please make sure to respond to that so that we can reach out to you, so that you have the opportunity to take advantage of those specials that we just mentioned. Okay, another great question. Is there a restriction on activity, exercise, etc., post-treatment with Daxxify?
So really, as we're learning more, I don't think there should be really many restrictions on any neurotoxins after we do them. There are a little bit more restrictions when we do filler, especially in the cheeks. The main one being you don't want to get a massage where you're putting your face down for an hour underneath the ring. But usually there's not very minimal restrictions with Daxxify or other neurotoxins in our office.
Yep, absolutely. Is RHA good for the jowls?
So with the jowls, the reason we get the jowls is because our skin is the same size the whole time, but we lose over age, we lose bone, we lose fat, we lose other volumes. So the table gets smaller and the tablecloth stays the same. So we can use RHA filler in the cheeks and along the jawline to help refill that table and enlarge that table so the tablecloth lays over that table more nicely. So it is one great option for the jowls. Often we evaluate the jowls to see if it is laxity. So to see if we want to do filler and some other tightening procedures, or if there's too much fat in the jowls, that then we can use Kybella or something else to kill the fat. So like I said, we have a lot of different options. And sometimes for the jowls, it does take a couple of different options.
Totally. combination is key. Somebody's interested to hear more about the tear troughs and what that's all about.
So often when we age, we have different fat pads, and as those fat pads separate, we get this hollow under the eyes or laterally under the eyes. So we'll do a little very conservative injection of filler. If it's also due to lack of cheek volume, doing the cheeks first will cause you to need less filler in the tear troughs, which is what we want. So then we use that with the cannula is the way that I do it, because I feel like it's the safest underneath the muscle, and just get a little bit to help that shadow underneath the eyes go away.
Awesome. Are all the injection points the same with this new product, like Botox, forehead, 11s, crow's, and chin?
Well, like I said, it is, but I think more and more we are doing individual injection points for each patient. So it's really not exactly the same for each patient or for each area. Yeah. It's each individual, but they are very the same. Often the push volume is the same because we're doing the same, of the dilution we're doing.
Yeah. And then this one's in regard to the specials. Does that second syringe of RHA need to be used at the same time? And that'll be a yes for that one.
Yes, that would be a yes.
And then that's the same question again. Okay, I think we're at the end of the question. So if there's anything else, you can pop in the chat. Otherwise, thank you guys all again for attending and joining us. Go Niners. Merry Christmas.
Merry Christmas.
Woo!
Perfect time. Halftime's almost done. So now we can get back to the game.
We can all get back to the game. Well, thank you guys all for joining.
Make sure you text
Respond
yes so you can win or you can get a free consult.
Yeah.
Thank you very much.
Bye-bye.
Have a good night. Thank you.